Hey, welcome back. This is Paramedic Project, and thanks for joining us once again. Last time talked about 12-lead ECGs, the importance of going to that happy ECG place in your mind every single time you pick up a 12-lead ECG, so that you systematically work through your analysis and interpretation of that ECG. So that is the biggest, most important point. Second thing I'd like to add in there is that yes, this 12-lead ECG largely has become commonplace in paramedic practice to allow us to diagnose STEMIs, giving our ACS patients access to reperfusion therapies from the pre-hospital environment. But in that setting, it's also really important to acknowledge that there's a lot more information that comes off these ECGs than just ST segments. And it's not just about STEMI diagnosis. It's about yes, that's a normal sinus rhythm, or no, that's not. And everything you find that is out of the ordinary on this ECG, you should have 3 or 4 differential causes for those differences just floating around the back of your mind. I'll give you some examples. So we print out a 12-lead ECG, the patient's bradycardic, should have 3 or 4 differentials for bradycardia. So inferior STEMI springs to mind, hypoxia springs to mind, hyperkalemia springs to mind. Is this patient not clearing their calcium channel blocker or beta blocker that they currently administered? So same thing goes for a tachycardic patient. Differential causes of tachycardia: anterior STEMI, pain, anxiety, seizure, hypoglycemia. So every single time we see something that's not normal in this ECG, we need to start applying some clinical reasoning to that, to whatever we find, to all of our findings on the 12-lead ECG, and that really allows us to remember and to start linking in the information we get off the 12-lead ECG to our patient's clinical state, and it allows us to continue asking that age-old question of what exactly is happening for this patient, not just, is this a STEMI or not? That's the second big tip. It's been Paramedic Project. Thanks for joining us once again. We'll see you next time.